Hello everyone, it's nice to see you here. So let me give you a tour inside J. Lopez Medispa and Wellness Center.
So basically, before you enter the clinic, we have our standard sanitizing procedure, hand sanitizer and temperature check before you enter the clinic. And we have air purifiers incorporated with our air conditioning system as well. And we also sanitize our facilities before and after procedures.
So integrative medicine is a combination of Western allopathic medicine as well as complementary, alternative, or holistic modalities. These alternative modalities may be Eastern-based, such as acupuncture, or other well-accepted modalities such as nutrition or hormone replacement therapies. We have several types of treatments, but before we recommend anything, we do a complete evaluation of the client because we need to know what is perfect for that individual and what the contraindications are before we recommend any type of treatment. Ideally, everybody needs to be tested first just to make sure there are no contraindications. Because like for instance, intravenous therapies is appropriate for everyone. However, there are those people who have G6PD deficiencies who may not be good candidates for, let's say, high-dose vitamin C drips or a treatment we called IBU.
So now we'd like to give you a tour of our treatment services.
So this is our oligoscan or OG scan for short. What it does is that it tests for heavy metal toxicity as well as mineral deficiencies. This is one of the first things that we do when we do an initial evaluation of our clients.
So this is our acupuncture room and this is Dr.
Hello.
Sigfried. So Doc, can you please tell us more about acupuncture?
Acupuncture is actually one of the treatments that we do here at J. Lopez MD. Actually, we trace it back to traditional Chinese medicine practice of preventing diseases. So we use these needles and insert it to the body. It's very thin needles, hair thin needles, and it's not very painful because they're very thin. And by inserting on the points here in the acupuncture, we're actually inducing the flow of the qi. So it balances the energy. It prevents diseases. We also have facelift acupuncture where we help lessen the wrinkles on the face, smile lines, crow's feet. So that will be good for anti-aging goals.
Hello Doc. Hello. So this is our IV room. So Doc, can you please tell us more of our IV treatments?
Sure. Intravenous nutritional treatments is a medical treatment that infuses vitamins, minerals, amino acids, and antioxidants into a person's system to improve nutritional imbalances. So we have a couple of clients here. Hi, how are you both doing? So right now, they're both getting the Myers cocktail, which again is a combination of vitamins, minerals, and certain antioxidants to improve physiological processes in the body. So this is our medical ozone treatment room, and this is Dr. Bella.
So EVO stands for extracorporeal blood oxygenation and ozonation. It is a medical treatment which incorporates the principles of purification, oxygenation, and ozonation to promote cellular healing.
Thank you, Dr. Bella. So this is our colon hydrotherapy room. So colon hydrotherapy involves the infusion of filtered water. What it does is that it helps improve gastrointestinal issues as well as skin problems. This is our infrared sauna room. It's otherwise known as infrared phototherapy. What it does is that it helps improve the process of detoxification through sweating. This is our hyperbaric oxygen therapy room. Hyperbaric oxygen therapy helps enhance the natural healing process. The combination of increased atmospheric pressure as well as an increase in percentage of oxygen helps treat in a variety of medical conditions.
This is the T-shot, which we use in testosterone replacement therapy.
And now that we've gone through all the services, we've seen all the machines.
All that we're waiting for is you. Come by and visit J. Lopez, MD, MediSpa and Wellness Center real soon.
Hi, good evening, everyone. I am Dr. Bella, a resident doctor at J. Lopez MD. Tonight, you will be hearing about post-COVID care. This is a general view of what we doctors in J. Lopez MD Clinic provide for our patients who are experiencing post-COVID symptoms. What are these symptoms? You better tune in and learn more about it. So, in addition to that, you would learn what supplements and other health tips that you may incorporate in your daily living if you are experiencing post-COVID infection effects, or if it's not you, you may know a loved one or a close friend who you know is in that phase. So I would also like to take this opportunity for a short plug. If tonight's topic interests you, after tuning in, we encourage you to also check out our past webinars seen on our social media platforms, YouTube, Facebook, and Instagram. Follow us and subscribe to get regular updates about our clinic services and treatments, and also know when and what our next webinar is going to be. So going back, the overview of tonight's program first is a background of what post-COVID is all about and the symptoms that are usually encountered. Then we will dive into the post-COVID care program that we provide, from consultations to testing, supplementations and medications, and also our in-house clinic treatments that would benefit our patients experiencing post-COVID effects. And then we'll have our question and answer segment. Finally, before we end the webinar, we will be raffling and announcing 3 lucky winners who tuned in for tonight's webinar, who will win free in-clinic services. So if I were you, I would really stay tuned. Okay, without further ado, let us welcome Dr. Sigfried Galang, our resident doctor here at J. Lopez MD.
Hello, Dr. Bella.
Hi, Doc Sigfried. So I can't wait to start. Let's welcome one of our main doctors for tonight. So to complete team, everyone, here is our very own wellness doctor, Dr. Joel Lopez. Hi, Doc. Sorry, maybe there's no sound. No. Okay, for a while, everyone, we'll just fix this. Okay, Doc Sigfried, do you have anything to say before we start our post-COVID care topic tonight?
Yes, this is a very interesting topic because we are so focused on treating the COVID. And once we treat the COVID illness, so we experience all the COVID, and then after getting negative tests, we just go on with our lives. So we forget that we are also having this post-COVID repair from the damages that the illness has produced after the
Oh,
COVID
yeah.
illness. Yeah. So
Yeah.
it's a very interesting topic for everyone who had COVID.
Yeah, I remember, Doc, our previous webinar, we've talked about a little bit of our experience um, being infected with this virus, right? Um, for you, have you experienced post-COVID symptoms in your case?
Yes, actually, after COVID, I had COVID in around April. It's like a, it's like I experienced the Passion of Christ because it happened in the first week of April or end of
Mm-hmm.
March, like that. So it coincided with the Holy Week. So after I completed the illness, I was okay. But after a few months, I started experiencing asthma attacks, which I
Mm-hmm.
don't usually experience because usually I just experience it in February when there's a transition of cold to summer. Now it's happening regularly already. So that's my post-COVID sequelae. It's the activation of my asthma attacks.
Oh, that's okay. I think Doc Joel is
Okay,
back
I'm
with
good now.
us.
Can you hear
Okay,
Hi,
me?
that's
Dr. Joel.
that's really good.
Good
Welcome
evening,
back.
everyone.
Sorry everyone for the
Good
technical
evening.
difficulty. Um, okay, so I think our guest viewers tonight are excited already for us to present to them about our post-COVID care program. So, Doc Joel, would you start our
Okay,
presentation?
so good evening, everyone. Once again, the topic for tonight is the post-COVID care program. But before that, let's discuss a little bit on the COVID-19 and what causes it, as well as the symptoms associated with it. Next slide, please. So COVID-19 could be divided into several phases, and these include a viral phase, in which the virus replicates within our cells. There's the inflammatory phase, as well as the hyperinflammation or the clotting phase. So these phases are associated with different symptoms. Next slide, please. So among the common symptoms of COVID-19 include fever or chills, cough, shortness of breath, difficulty of breathing, fatigue, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, as well as diarrhea. Next slide, please. So these are the treatments that are usually done at home, and this is what we actually do recommend because the current treatments just would include symptomatic treatments such as the use of, let's say, Tylenol for fever. But of course, as we all know, this is not the best way to treat um, a viral infection. So to treat a viral infection, it's really important to provide immune support, and that would include the use of multivitamins, vitamin C and D, zinc, quercetin, and melatonin. And of course, there are antivirals that we also would recommend, including ivermectin, hydroxychloroquine, and probably also use the antibiotics, which have antiviral properties as well. And that would include doxycycline and azithromycin, as well as using nasal or mouthwashes, including betadine. And then during the inflammatory phase, we use medications such as ibuprofen. And for those who want to go natural, they could use N-acetylcysteine as well as antihistamines. These antihistamines may include quercetin as well and anti-inflammatories such as bromelain. And during the hyperinflammatory or clotting phase, people may use aspirin as well as natural blood thinners. And finally, system support. Basically, this is the symptomatic treatment of symptoms such as that, including fever, where we use a paracetamol, and cough medicines. And for those who want to use natural cough medicines, they may use, of course, NAC and other mucolytic agents. Next slide, please. So this is just a summary of the supplements that we use and the dosages of each one. And we're going to be discussing all these later. Next slide, please. So we now go to persistent COVID-19. So basically, it's defined as having symptoms of COVID 3 weeks or beyond. And there are those that that define it as having symptoms of COVID for 12 weeks or beyond. It's also known as post-COVID syndrome, or those or another term as long haulers. So next slide, please. So the length of the symptoms could also depend on the severity of COVID-19, and also whether the patient was treated as an outpatient or as an inpatient. It will also depend on the particular symptom that the patient experiences, such as fever or shortness of breath. Next slide, please. So what is long COVID? So these are the possible underlying causes of what we call long COVID or long haulers. One is post-viral fatigue syndrome. This is what we usually see in viral infections, such as those infected with EBV or CMV, called chronic fatigue or chronic fatigue immunodeficiency syndrome. So people who have this post-viral fatigue syndrome may have what we call autonomic dysfunction or dysautonomia, in which a person has what we call sympathetic dominance. So these are people who are always in a fight or flight mode. So basically, their body is not able to rest. And when you're always in a fight or flight mode, this leads to symptoms that would include fatigue, as well as other autonomic symptoms, such as hypotension, or maybe dizziness, headaches, even rashes, and so on and so forth. Another possible underlying cause of long COVID is endocrine system dysfunction. So during the viral infection, a person's hypothalamus may be affected. And when a person's hypothalamus is affected, then it may affect the rest of the endocrine organs in the body. Another very important possible cause of long COVID is mast cell activation syndrome. So mast cells are basically cells that are found in different tissues in the body. So if these mast cells are activated, it could cause symptoms that could vary from headaches, fatigue, rashes, gastrointestinal disturbance, and all the possible symptoms that you see when you get this long COVID. We would show you the other symptoms that are included in this long COVID condition. So exacerbation of existing intolerances and deficiencies could be another cause of long COVID. And finally, organ damage from the virus particles or the viral debris could be another possible cause of long COVID. So next slide, please. So these are the common symptoms associated with COVID, the most common of which is fatigue at 58%. But you could see here there are about 50 symptoms associated with long COVID. Next slide, please. So the most common physical symptoms associated with long COVID include, number one, fatigue, followed by dyspnea or shortness of breath. Then there's chest discomfort, cough, and lack of sense of smell or taste. These symptoms may persist beyond 3 months or so. Next slide, please. Common neurological symptoms include PTSD, brain fog or impaired memory, poor concentration, as well as anxiety and depression. Next slide, please. So why post-COVID care? The reason we do this post-COVID care is because we see a lot of clients who are experiencing symptoms beyond 3 weeks. Oftentimes, we see clients who are having vague symptoms that may include fatigue, of which there are no possible underlying causes. So when we see clients who have a history of COVID and who have history of who are presenting with different signs and symptoms, then we think about possible tests to run, as well as possible treatments or treatment recommendations for these clients. Next slide, please. So, who would be discussing the testing? Would that be me? Sorry.
Yes, Doc.
Yes, Doc.
Okay, I'm sorry. So these are the tests that we do recommend for those who present with long COVID symptoms. First off is the D-dimer. This one would tell us if there's micro blood clot formation. Of course, it's necessary to know your antibody test. Then we also check for G6PD for those who would be candidates for high dose intravenous vitamin C therapy or for a treatment called EBU or extracorporeal blood oxygenation and ozonation. It's also important to get a baseline chest x-ray as well as a blood count with with particular attention to your basophils as well as your eosinophils. It's also important to check your vitamin D levels because vitamin D is an immune modulator. And we've seen among our clients that most of them are deficient in vitamin D, even though we live in a tropical country. Then it's important to know also inflammatory risk factors, including homocysteine, high sensitive CRP, ferritin, and fibrinogen. Other tests that we do also test include your pulmonary function tests, clotting time, bleeding time, as well as T cell studies. Later on, we could talk about case studies. But for the next topic, next slide, please.
Dr.
Okay, so
Sigfried?
yes, thank you. So we go now to the supplements that we can take for post-COVID care. So this is what I take after having COVID since April. So I'm already healed from the COVID, but I'm still experiencing post-COVID sequelae, like the activation of my asthma attack. So I would need the help of these supplements. Example, this one, the Core 8C, which is in the orange bottle. Can you see that? Yeah, the orange bottle. So that's vitamin C complex. So it's different from the usual ascorbic acid that or sodium ascorbate that I'm prescribing because the component of ascorbic acid is just the covering of the vitamin C complex. So it's the antioxidant that protects the important core factors. That's why we call it core 8C. There are 8 factors inside the vitamin C complex of Vitalic Core 8C. So this would include ascorbic acid, the P factors, the J factors, K factors, bioflavonoid complex, ascorbinogen, then tyrosinase, and rutin. So aside from ascorbic acid antioxidant properties, these other factors help in stabilizing the capillaries, the blood flow, the circulation, and other benefits for the body. Okay. The other one is Vitale Forte. So this one has 10 essential oils. So I use this to prevent other viral reinfection. So before the entry of the virus, it's already blocked by the different oils, and if it ever it enters the cell, it's also stopped from multiplying or replicating. And also, even if it exits the cell, it's also blocked. So the 10 essential oils include oregano oil. As we know, it's very antiviral. Curcumin and ginger, which is anti-inflammatory. Basil, frankincense, clove, sage oil, cinnamon oil, thyme, and peppermint essential oils. So it's a very important supplement for post-COVID. And then I also use Vitali Rich. It is a lot of 100 synergistic nutrients. And one of the most important nutrients here is the amino acids. Has one of the highest protein content. So when we are building immunity to the COVID, we need building blocks like amino acids to build the antibodies. And also it's needed by the immune system to build itself and to be stronger. Okay. Are there any inputs, docs, for these three vital immune packs?
You
No,
can
you got it
continue.
covered.
Okay. Okay. So the other supplements that I'm taking is N-acetylcysteine. So N-acetylcysteine is a precursor to reduce glutathione. So it's an antioxidant, anti-inflammatory, and immune modulating, just like vitamin D. Well, I use this if you have continuous phlegm, like coughing, but you still have phlegm sticking inside, then we can use N-acetylcysteine to dissolve this phlegm and cough it out. And another one is quercetin. So quercetin is a flavonoid. It is found in different fruits and vegetables, especially the capers, onions, and kale. But if we have post-COVID, we need it more, so it can be in a supplement form because it's also a zinc ionophore. So zinc ionophore means it allows the zinc to enter the cell through its fat membrane, lipid membrane. So it is antiviral, antioxidant, and anti-inflammatory. It has immune protective effects. It's actually used before for cancer and heart disease. Okay. And then the other one is vitamin D3. Of course, that's why we check for the levels of vitamin D. Because even if we are in a tropical country like the Philippines, most Filipinos have low levels of vitamin D. And the survivors of COVID usually have higher levels of vitamin D as compared to those who did not survive or who died from COVID. So vitamin D3 is an immunomodulator. So it prevents hyperinflammation, which is the one of the problems with COVID is the high inflammatory response of the immune system. Okay. And then we have probiotics. So usually we have antibiotics when we treat cough to prevent pneumonia and preventing acute respiratory distress syndrome later on if the cough continues or the pneumonia complicates. So probiotics replenishes the good bacteria that the antibiotics may have destroyed. And then aside from that, probiotics has an immune benefits also, like production of the T regulator cells, which also regulates the immune system. Then I also use zinc, as of course it's an antiviral, but it's also important for antioxidant, its anti-inflammatory effects. Okay, and it's also important for the white blood cells for its tools and armaments. So without zinc, it's like a soldier without armaments. So if the soldiers go to war and they don't have their tools, they will lose. So zinc is there for that. And then melatonin is a chronobiotic, which is a circadian rhythm regulator. So it helps to balance our sleep, and also it acts like an immunomodulator also, an antioxidant which protects the cells. Okay, so that's
Thank you
my
for that.
inputs for the supplements.
Thank you for that, Doc Siegfried.
You're welcome.
We can go to the next slide. Okay, so what Doc Siegfried mentioned is the supplement for our basic supplement for our post-COVID care. Now I will present to you the supplements that we use in case-based basis, which is problem-focused. So there are a few symptoms here which I will be discussing. First is fatigue. So it's one of the most common symptoms that Doc Joel has presented earlier with post-COVID symptom effect, post-COVID effects, infection effects, right? So we use ubiquinol and L-carnitine. Both of these supplements help make energy. So with ubiquinol, it is found in the mitochondria. Mitochondria is the part of the cell which produces ATP, and as we know, ATP is the energy currency of the cell, right? So it's also found out that in studies, low level of ubiquinol has a role in mitochondrial diseases, and one could experience symptoms of toxicity because of oxidative stress, because you have low levels of ubiquinol. While L-carnitine helps produce energy in the cell through fat utilization. There is also an ongoing hypothesis being studied and researched on long COVID effects. Upon that, they are studying the NAD deficiency for long COVID, and NAD is associated with in energy production, as well as there are to address that, there are supplements that we could provide, like niacin, zinc, selenium, as a few of those to address the NAD or nicotinamide adenine dinucleotide deficiency. So it's so there. Next is persistent cough. It is also one of the most common symptom, and we use N-acetylcysteine. Um, it has a powerful anti-inflammatory, antioxidant, and immune balancing properties. It protects the cells by neutralizing toxins, replenishing glutathione, and also it loosens thick mucus, which is also common in it's a common symptom during the COVID infection. We can also recommend cough mixtures, steam, inhalation, and ginger teas as well. For brain fog, we could recommend Bacopa monnieri. It is a supplement that you may take as it helps counteract brain fog. It is a brain tonic in Ayurvedic medicine. Next is shortness of breath. We could use the supplement like magnesium, which is beneficial for being a relaxing mineral. And studies have shown that magnesium sulfate in particular has a bronchodilator effect. Next is we also used essential fatty acids for its anti-inflammatory properties, which help mitigate inflammation in general and also inflammation that is happening in the lung. Next, anxiety. It's one of the most common neurological effects in a post-COVID sequelae. We use 5-HTP, which is able to convert to serotonin, and serotonin helps improve mood and also improve the general well-being. For both of GABA and HTP, it helps in relaxation. These two are basic supplements that we recommend in certain cases. In addition, I just want to add that there's some cases that patients have gut-related issues, and we recommend probiotics, pancreatic enzymes to help the digestion, and also supplements like diamine oxidase supplements or supplements addressing histamine intolerance, which is what Doc Joel mentioned. It's one of the mast cell activation syndrome is one of the causes of long COVID sequelae. So that's all for the supplement guide problem-focused treatments. We can go to the next. Okay, Doc
So
Joel.
so these are the supplement guides for those people who have the following tests. For those who have high D-dimer, which is a marker of microblood clotting formation, we may recommend a supplement called nattokinase, which is a fibrinolytic agent. For those who are not responding to nattokinase, we may recommend something called lumbrokinase or serrapeptase. And we do have a supplement called BP Lina, which actually contains natokinase and other anti-inflammatory supplements. For those with high ferritin levels, again, ferritin is an inflammatory marker as well. We may recommend a supplement called lactoferrin. For those who have low antibody levels, it could be due to a deficiency in amino acids. And in this case, we may recommend essential amino acids or the use of transfer factor. And for those with pulmonary fibrosis based on chest x-ray, we would recommend a supplement called natokinase. Of course, these are just like more of like a symptom-based approach, like the one Bella mentioned earlier. And as far as this test, it's more specific, but we really want to go to the possible underlying causes. So in the case of long COVID, we're thinking about sympathetic dominance, or a condition that happens when you're in a hyperarousal state. So people are not able to relax, rest, and recuperate after COVID. That's why it's really important uh, to take care of your parasympathetic nervous system, especially after a viral infection. Again, another possible underlying cause of all these symptoms is the mast cell activation syndrome, which could typically present with fatigue. So people would definitely respond by taking uh, by being on a low histamine diet, as well as taking supplements that would actually address the oxidase levels, as well as taking supplements that have anti-histaminic or anti allergy properties, such as bromelain, as well as quercetin. So it's really important to look at the underlying cause or causes. But while figuring out what these underlying causes are, it's really important to at least treat the symptoms with first off natural remedies and going back to the basics. Like if a person's still recuperating from a viral infection, it's really important to really address the convalescent period, and that's by really taking it easy, getting enough rest, getting enough sleep, getting enough nutrients from your food, and taking it easy. Basically, if you have to stay at home and not go back to work or school, you really have to do that, because it's really a time in which you have to really focus on getting well before doing any type of like strenuous activity. So for our next topic, um, next slide, please. So who's gonna do this in office treatment?
Okay, for the in-office treatments, next slide, please. There. Doc Joel, do you...
Okay, so yeah, so for the hyperbaric chamber, yeah, it's really important to do this treatment, especially if a person's chest X-ray comes up with a pulmonary fibrosis. Uh, well, I don't want to tell you this, but I guess I have to be transparent. I actually had COVID back in late March. Um, I had moderate to severe symptoms, but thank God I was able to get well using the treatments that we have at home as well as in the office. So treatments I had at home include the IV therapies, which will be discussed later. I also had some oxygen therapies, but when I came back to the office, I did a hyperbaric oxygen therapy twice or more than twice a week because of apical pulmonary fibrosis on chest X-ray, which actually disappeared after a month. So that's how effective this treatment is. Because normally uh, patients who have pulmonary fibrosis are just advised to have some oxygen at home. But if you really want to get well or reverse this issue, hyperbaric oxygen therapy would be a good thing to consider.
Okay. Thank you, Doc.
So for the next,
Next slide,
you're
please.
welcome.
Okay. For EBU, or what we call extracorporeal blood oxygenation and ozonation, we recommend it to do once or twice a month, but it is as Doc mentioned in the start of our presentation, we need to have a consultation first prior to the treatments, because we want to know which treatments would really be suited for you. It's normally we personalize our usually we personalize our treatments. So with this treatment, it's for purification, ozonation, and oxygenation of the blood. It is one of the general treatments that we use for our detoxification program. So in doing this, it is we are aiming to remove the viral particles that is still circulating in our system to decrease the toxicity load, and to help also clean the liver, for better better detoxification process as well. So there, and then we have two more, which is what's the next? Okay, acupuncture. Doc Sigfried?
Okay, acupuncture is also important for post-COVID care, although it's also used during the COVID illness, just like what was done in China. So it's a complementary treatment for COVID since last year. So for post-COVID care, acupuncture, Dr. Joel mentioned about autonomic dysregulation, where the sympathetic nervous system is in our overdrive. So we want to know what are the treatments that can help i- induce the parasympathetic nervous system. So one of them is acupuncture. So it will help to relax the body, the mind, and the spirit. It's also beneficial for those who have anxiety, depression, post-traumatic disorder after the COVID illness. So I usually use ear acupuncture together with the IV treatments. So I can place the ear acupuncture. Although Dr. Bella's also going to do the acupuncture also. And for for overall effects of COVID to the meridians, actually there's depletion of their chi. So it causes fatigue. So that's the language of traditional Chinese medicine is the word qi, which is the energy or life force energy of the body. So during COVID, there's depletion of that. And through acupuncture, we want to revive the balance and recover the flow of the qi in the body so we can remove the pains that the person is experiencing post-COVID, and also digestive problems, issues like bloating, diarrhea, and also brain fog. We also acupuncture can help in terms of balancing the endocrine system. So as doctor mentioned about the um, hypothalamus, so during COVID, there's a blockage of the hypothalamic release of the hormone. So acupuncture, in a way, can balance the endocrine system also. Okay, so that's for acupuncture.
Okay, next. Immune drips. Doc Joel, would you like to start with it?
Okay, so one of the treatments that we do recommend for those who have who are long haulers are the immune drips or intravenous nutritional drips. So it varies from Myers cocktail, NAD, plaquex, and so on and so forth. But we actually do tailor the treatment according to a person's needs. So this would also be based on blood tests as well as functional testing that we do at the office, such as the oligoscan, which would determine if there are any heavy metals or any mineral deficiencies in the client. So the recommendation is to have a treatment like a week, like once a week or twice a week, and frequently evaluate the patient So ideally, a person should do all of these, but if not, at least do some of these to make them recuperate faster.
Yeah.
I believe we did this IV drips during the time we had COVID in the end of March to April. That was we recovered. Like me, I recovered faster. So I really felt dehydrated that time. So the IV drips helped me hydrate faster.
Mhm.
That's that also goes
Great.
for me.
Mhm.
When I had my infection, I I was at home and then I did the drips for myself because no one there is with me to do the drips, and it really helped the hydration and recovering faster because it has this high dose of vitamin C, and also um, magnesium is in it. So it helped uh, me relax in a way. Yeah. So okay, I think we're almost done. Let's go to the okay. So everyone, we're done with our presentation, and I just want to reiterate, summarize what we've talked about. The post-COVID care program by our team, J. Lopez, MD, consists of consultation for focused care, focused meaning for post-COVID infections, and also we discussed the post-COVID, what includes in the post-COVID care program, which includes consultation, blood tests, supplements, and medications, and also in-office treatments, which are personalized. And also there's lifestyle, health, and nutrition guidance. So if you guys are really interested, if you know someone who is experiencing this, or you are experiencing symptoms of post-COVID infection, contact us. We'll hear from you, answer your questions, and um, so that you can start the program for yourself. Okay? Do you, do you doctors want do you doctors have anything to add before our question and answer portion? Okay,
No,
none from
no,
now.
nothing to add. Yeah.
Okay. Are there questions from the audience or? Oh, okay. So here, thank you, Mr. JP Villegas, for this question. What treatments can we have for COVID prevention? So I want to answer this, and then other doctors could add on it. So for the treatments, like we said, there are managements that we could do. First is the testing and also the supplement, which are guided by what symptoms you have, or it's based on the laboratory test, and also we add the basic supplements like the vitamin C, vitamin D, zinc, right? And also there's in-house treatments like IV drips, which is the most common, and also the hyperbaric treatments, and acupuncture, and also the ozone treatment. These treatments again are personalized, so that's why it's important for you, for our clients to be consulted beforehand. Anything you want to ask, doctors?
Yeah,
I'm
basically
sorry.
for those people who don't live in the vicinity, let's say from other places, they could actually take supplements, oral supplements that would help with their innate immune system. So this supplements like Dr. Um, Sigfried mentioned earlier include uh, our Core 8C, which is basically vitamin C complex, D3, zinc, as well as quercetin. So most people have access to this, so they could start taking this as part of their prevention program. They could also start taking, of course, with the uh, how do you call this? Ideally, they should work with their own doctor to
Mhm.
prescribe ivermectin for them, because it's been found that it really helps in the prevention as well as early treatment of COVID. So, yeah, just to add to what Dr. Bella said.
Yeah, thank you, Doc. So with the ivermectin,
Thank you.
since last year, we've been following protocols, international protocols, and even protocols from
Mm,
local doctors, and it's been changing because of the variants, right? So that's why
mhm,
consultations are important for the proper dosaging, specifically the proper dosaging and when to take these medications and treatments and supplements.
mm.
Okay, thank you, Mr. JP, for that question. Any more questions? Okay, from Miss Lance Molina, do we drink all three together? Okay, so I will assume the three are the pictures that we've shown earlier, the Vitalic Core 8C, the Forte, and the Vitali Rich. Since it wasn't included in the question specifically, I am assuming that those three. So with those three, we recommend it to be taken after meals, right? And there's no problem with taking those three supplements at the same time. But I think we um, there's certain times like after in between meals um, that you could take the forte, which is the essential oils. Um, yeah, it's possible that you can drink all the three supplements, the JLo organic supplements together. Anything that you want to add?
So she's talking about the Vital Immune Pack.
The question didn't specify it, but I am assuming it's the
Mhm.
three JLo organic supplements. Yes.
Yeah, actually
Oh,
they are a team. So they're like super friends. So three is better than one. So so in during the COVID illness, we take all of them together, and then even post COVID care, you can take them all together. But of course, it's not as many as during the COVID illness. So, but also it depends on the consultation, depends on the discretion of the doctor. He wants to increase the dosage depending on the symptoms.
yeah, exactly. I hope we answered your question. Miss Lance Molina, is there are there any more questions from the audience? Okay. Miss Malu Navarro, I had G6PD test before having COVID. Should I take it again? Okay. With the
No.
G6PD test, it you can just show us your recent G6PD test, and we would assess. Sometimes it could change, right, Doc? It could change. Um, for me, from if you are G6PD deficient, uh, quantitatively, for when you do treatments for yourself or supplementations, it could the your quantitative levels of G6PD might change, and after that previous deficient test, your results for the next test could be different or could already be normal. So with the G6PD test that you have before, you could just show it to us, and then we would assess from there. Normally you don't need to have a repeat test for that normally, but um is there anything that you would like to add, doctors?
Yeah, I don't think it's necessary to repeat the G6PD test. Anyway, we tested a lot of Filipinos being here in the Philippines for G6PD deficiency, and we hardly see any. It's more common in the Mediterranean population. And actually, we do recommend that a person does this test prior to having high dose vitamin C therapies, that's intravenously, as well as before doing the Ibu.
Yes. Thank you, Miss Malu Navarro. Is there any more are there any more questions before? Okay. From Mr. Luis Acosta. What are the possible post-vaccine side effects for Moderna exactly? Doc Joel, can you lead
Well,
us to
this
this answer,
yeah, well
to this question?
yeah, the three main ones that are mentioned in the literature, and this one I got from the IFM, Institute of Functional Medicine. Uh, for Moderna as well as Pfizer, it's usually anaphylaxis, but the incidence is like one out of uh, millions. But this is what they say in the literature. But as far as real life, we hear about people getting anaphylactic conditions. Um, and then another common thing is Bell's palsy, another common side effect, as well as probably some issues with blood clotting, although that's more pronounced in the AstraZeneca vaccine. But the two main ones include anaphylaxis as well as your sorry, yeah, yeah. So those two primarily, yeah. Of
Actually,
course, if you go online, you could also see other possible um, side effects. There's a website called VAERS, VAERS.com, or OpenVAERS, Open, VAERS.com, and they list down all the possible side effects associated with the vaccines.
so they could also do tests so that we can see how it affects their blood picture, isn't it, doctors?
Yeah, I would agree for
Yeah,
go Doc Joel.
yeah, actually, yeah, what we do is we want to individualize our recommendations when it comes to vaccinations. For those who have been scheduled, let's say a few days, it's a few days before the medical procedure, you want to make sure to pay attention to your sleep, because it's been found that people have good sleep prior to the vaccination have a better response to the medical procedure. It's also really important to not be stressed out prior to the vaccination, because that would also affect how you respond towards the vaccine. It's really important for those who have scheduled their medical procedure like 2 weeks from now. They would like to take care of the comorbidities first, because people who have comorbidities usually have more untoward reactions towards the vaccine. And these comorbidities include obesity, um, people with diabetes, people with hypertension, and people who have a history of allergies.
Okay. Thank you, Mr. Luis Acosta. I think we have one last question. Okay, from Mr. Alvin Albarillo. How long does immunity last for COVID-19? Okay.
Okay.
Doc
Yeah.
Joel.
So if is this after COVID-19 or after
After.
vaccination? So it's
No,
after
it's
COVID-19, right? Yeah,
yes.
supposedly after COVID-19, you have natural antibodies that would last for a long time. And these are natural antibodies compare like they're different as like from that produced by vaccination. So these natural antibodies are produced by your B1 cells, whereas the ones produced after vaccination is produced by your B2 cells. So the ones produced from natural immunity usually last longer. And since it actually addresses all the proteins um, on the surface of the virus, so it's more, how do you call it, more comprehensive compared to the ones produced after the shot because you're only basically producing antibodies against the spike protein. So that's the main difference between those types of antibodies. Uh, so yeah, if you just check for antibodies, sometimes it would only last for up to 6 months post-vax. So uh, whereas with a infection, with a natural infection, the antibody supposedly would only last also for up to 6 months. However, there's T cells which should tell us more about long-term immunity. However, this test is not yet available in the Philippines. Hopefully, it should be available soon. That would actually tell us about long-term immunity against COVID.
Yeah, I just
So, guys, anything to add?
yeah, I just want to add, um, that's why we recommend to have yourselves tested either with the COVID quantitative antibodies or the neutralizing antibodies. So depending if you had a infection, a natural infection, or um, you have just been vaccinated, fully vaccinated. So it depends on that what test we would be recommended for you. And it's really a nice test because we it would show to us if the antibodies are reactive or not, right? So it's really a good baseline for everyone, those who got infected and also those who have been vaccinated. It's a really good thing to or test to be aware of. So yeah, thank you, Mr. Alvin Albarillo. That unfortunately, everyone, that is our last question. We have run out of time. If you have questions, just message us directly on our social media accounts. Um, yeah. Before I go to the end of our and announce the winners, anything you want to add, doctors? Okay,
We're
so
good. Thank you.
they've said a lot already. We've said a lot already throughout this program. So, all right. Um, let during the during the presentation, one of our staff ha is been tasked to raffle out your names, our viewers, for three to win there will be three individuals who will win three different in-house treatments. So I think the names are already ready there for everyone to show or Okay. Ooh. Okay. So for our first winner, winning an infrared a session of infrared sauna, Mr. JP Villegas. Thank you, sir. And also thank you for your question earlier. So next is the second winner for an IV therapy. So your IV therapy would be a Myers cocktail. Miss Malu Navarro, thank you for participating with us. And our last winner is going to be Mr. Luis Acosta for a session of hyperbaric oxygen therapy. So these three individuals, you will be contacted by one of our staff for further details and also for scheduling. Thank you
For
for
joining
joining
with
with
us.
us.
Doctors,
Doctors,
anything?
anything?
Yeah, once again, thank you so much for joining us tonight. And we
Okay,
hope
Thank
you'll
thank
you
join
so
us
you.
next
much.
time.
I hope you learned so much.
Okay,
Okay,
thank
thank
you
you
again.
again.
Thank
Um,
you.
if another plug before we end, if you if you guys learn and took something away from this webinar and took interest in the topic tonight, we do Q&A Wednesdays every other Wednesdays. So please go to our social media accounts on Facebook, YouTube, and Instagram. Check out check out our posts and past webinars. Also, follow and subscribe to our accounts. We cover topics from health prevention, acupuncture, hormone therapies, nutrition to anti aging topics, and a lot more. For your questions and appointment scheduling, we would love to hear from you. So contact us in the details provided, maybe in the description below or shown in the screen. Again, everyone, Dr. Joel and Dr. Sigfried, thank you again for your time till our next Wednesday. Be safe and stay healthy, everyone. Thank you.
Thank you. Thank you.